Hey, Dr. Ray here with Pro Holistic Care. Today I want to talk to you about some exercises and stretching that you can do when you're pregnant to be more comfortable, try to help avoid pelvic and back pain. I have 3 kids myself. They're pretty old now, but I remember how achy and tight my pelvis would get, and just having some strategies for things you can do on your own to help can be really helpful. One strategy I'll tell you right away is if you are having low back pain or pelvic pain, use some ice. You're pretty much always inflamed when you're pregnant, so ice can be really helpful and bring that inflammation down. Now, 20 minutes, always use a towel. Let me make those recommendations too. You want to ice for about 20 minutes with a towel wrapped around it. Some stretches and exercises we can do to keep the pelvis and low back comfortable. The first one is something I'm sure you already know about, is cat-cow. This one can be used in pregnancy to stretch out that low back and the pelvis. Now, you want to stretch up, and then you're going to come down. Now, in pregnancy, I don't want you pushing really hard and extending the back and pushing the belly down really far. We want to be really gentle. So you want to come up, give it a nice stretch and a nice hold. Come down. Light stretch, come up again, and I'd start with about 10 reps of that. Do that a few times a day. Now the next one we are going to do is we want to do some pelvic mobility and low back mobility. Now I'm going to do it on this table, and you can do it on a chair, but if you have a exercise ball at home, an exercise ball is great. You can get better range of motion if you're doing that. So basically, we want to start to bend our pelvis down, push the pelvis down, for lack of a better term. So we're pushing to the right, to the left, and you want to do, let's say 10 on each side. 10 to the right, 10 to the left should be good. Now once you've done 10 on each side, we're going to go front to back. And I want you to think of your pelvis rocking front to back like that. That's going to stretch the low back and the pelvis. So you want to tuck the pelvis under, tuck the pelvis back, tuck it under, go back. Kind of think of sticking your butt out, but again, you don't want to push really, really hard. You just want gentle, fluid movements. And again, this is going to be easier on an exercise ball. So back and forth 10 times. Now, the other thing that can happen in pregnancy is your hip flexors can get really, really tight. So I'm going to show you how to do a hip flexor exercise or a stretch. You can do this on the floor. I'm going to do it on the table. I wouldn't recommend you do it on a table. You don't want to fall off the table, but you want to do it on the floor. So our hip flexors are located here in the front. So in order to stretch this hip flexor where my knee is down, I'm going to bring this foot out. I'm going to tuck my pelvis under again, and I'm going to lean forward. Now right away I'll start to feel a nice stretch in here. Now if we want to get a little bit more of a stretch, we can even bring the arm up and just stretch a little bit. And again, we're going to do that on each side. I would say 30 seconds, 2 times on each side is plenty. And keeping those hip flexors can really help, or keeping them loose can really help avoid back pain, low back pain. And then of course, if you're having other aches, pains, problems, talk to your chiro, see what other exercises or stretches they recommend, but those 3 are 3 great ones you can start with.